Hi, welcome to PK's classes. Today we will study angina pectoris and the anti-anginal drugs which can be used in angina pectoris. This angina pectoris this is derived from two words, angier, okay, and pectus. Okay, angier means to strangulate, and pectus means the chest. So when there is strangulation of the chest or chest pain, we call it as angina pectoris. So it is a cardiovascular disease where there is chest pain, and this occurs when the coronary blood flow, coronary artery is the artery which flows blood to the heart. So when the coronary blood flow is inadequate, because your heart, its main function is to pump blood, and that means it is a work which it has to do continuously, and for this it needs energy, it needs oxygen, and the coronary artery supplies oxygen to the heart, and if the coronary blood flow is inadequate, then the heart does not get sufficient oxygen, then it starts strangulating and there is chest pain, and that condition is called angina pectoris. Okay, so we can say that means in angina pectoris the oxygen supply to heart, okay, and oxygen demand of heart, there is a imbalance. So oxygen, suppose this is the balance, normal person, and when this is like this, that means the oxygen supply is decreased. Oxygen supply is decreased, but the oxygen demand is same, or even if same, that means there is no balance, and this causes your angina pectoris. So this causes angina pectoris. So what we can do? We can increase the oxygen supply. How we can increase the oxygen supply? We can increase the oxygen supply, so there will be balance, and oxygen supply we have to increase means we have to use vasodilators. Vasodilators which can dilate the coronary artery. Okay, so like your nitrates. Okay, nitrates, they can supply blood, and we can also use calcium channel blockers. So calcium is causing your vasoconstriction, so calcium channel blockers will cause vasodilation. Okay, or we can decrease the workload of heart. We can decrease the workload of heart. So workload of heart will decrease, that means the oxygen demand will decrease, and we can use drugs like beta blockers, calcium channel blockers also, okay, and even nitrates also. They can decrease the workload of heart, and the oxygen demand can be decreased, and in this way all these drugs we can use in case of angina. So now let us discuss what are the types of angina. There can be three types of angina, and one is your classical angina. One is classical angina, also called as stable angina. Classical angina or stable angina, or angina of effort, or exertional angina. The same name can be used to describe the same. And also we call it as typical angina. Typical angina. So this is the most common form. This is the most common form of angina, where there is obstruction of large coronary arteries, and because of atherosclerosis. So there is atherosclerosis, there is deposition of cholesterol, there is hyperlipidemia, and the coronary artery is blocked. Coronary artery is blocked. So the blood supply to heart is decreased, and when there is little bit exercise, or there is some emotional trauma, or after heavy meals, okay, emotion, so all these can cause the chest pain, that is called classical angina. And in this case we can use all these beta blockers, organic nitrates, calcium channel blockers, like that. Then number 2 is your variant angina. Variant angina, or Prinzmetal's angina, or we also called it as angiospastic angina. Okay, and here there is a transient spasm for a less time. There is transient for a small period of time. There is a transient spasm. Okay, and this is reversible. So there is reversible coronary vasospasm, and this can occur at rest or during sleep, and this is uncommon. This is common and this is uncommon. Okay, and there is a third type of angina called unstable angina. In the unstable angina, there is episodes of angina at rest. Episodes of angina at rest or at normal exertion. And the major cause is your thrombosis or platelet clots. So these two we can use by here we can use the vasodilators. Okay, here we can use the vasodilators, mainly coronary artery vasodilator. Here we can use the drugs which can decrease the workload of heart. Okay, and here we can use antiplatelet drugs. And in detail about all the individual drugs used in angina, we can study in our next class. Okay, so we'll study one by one. Thank you.